Hello and welcome to Crackin Up Conversations with Chiropractors. My name is Laura Rigby, I'm a chiropractor, and this...
I'm Francesca, the chiropractor made in the head.
And I'm Raddy, the sports therapist.
The only male in our business. Is he brave or is he stupid? Answers on the postcard, please. Alright, so today we're going to talk about shoulders. When I first started in clinic 15, 16 years ago, the majority of people that I used to see actually had lower back pain, but slowly, probably over the last 10 years, 7 to 10 years, we're getting more and more shoulder problems, neck, shoulder, upper back. So I thought it was really important that we actually discuss this today and just kind of cover all of our bases with a sports therapist and a chiropractor, what we see in clinic, what you may know for yourselves, and how we can help you as well. So let's get this show on the road. Really, I think we should talk about, first of all, the main problems that people come in with. So Francesca, do you want to start?
Yeah. So what I see a lot of the time is, as you said, rotator cuff problems. A lot of people come in and they're like, oh, my shoulder's really painful, don't know where, and then that's what we do with the physical exams where we narrow it down. In general, it could just come from, say, the muscles itself, the tendons, the bony joints, the capsules inside, but that's why we just need to narrow it down. So rotator cuff problems in general, we can help as well.
Frozen shoulders, because when we've had rotator cuff problems, it can lead, or it can be individual.
Absolutely. If it's not managed properly, mobilized especially, or properly rehabbed, then it could lead to further problems, especially in the future.
For sure.
Definitely. I think another one is shoulder impingement. I personally have suffered a lot in the past, probably in the past 15 years, but in the last 12 months, it's actually stopped me from practicing as regularly with a shoulder injury, and that is perhaps a shoulder impingement where the actual shoulder in itself doesn't sit properly in the socket, or there's a little growth. So this is your shoulder, and this is the ball part, and there's your socket part, and there might be a little growth, or the shoulder might be quite narrow in the capsule, in the joint, and that will stop your movement of your shoulder joint if it's not sitting as it should be. So that kind of movement there, we'll probably try and get a diagram, okay, where it stops the movement, rather than if it was fully in, it'd be moving better. That's a big one that we see as well. And I suppose for you, Raddy, sports-wise, tendonitis, bursitis?
Yeah, get those a lot, like you said. Yeah, frozen shoulders are so common. Sort of like, again, the impingement as well, sort of. Get them all really. But yeah, say frozen shoulder, I'd say for me, is probably the most common.
Do you get any? So for me, when I was in the gym, I damaged my shoulder actually just by doing a shoulder press. But there's a lot of kind of like overhead sports where you throw in, which can create shoulder injuries as well, like a repetitive strain where the shoulder's kind of hitting against.
There's sort of loads of sports that cause the shoulder problems. I mean, you got golf here, that's very common that we get in.
What kind of injuries would you get in golf with a shoulder?
Again, mainly impingement.
Okay.
But you do get, it can sometimes freeze up as well. We see a lot of golfers that we get sort of rotator cuff freezing or the shoulder freezing.
And is that caused by golf, or is that something that they're doing outside of the actual, outside of playing golf? So they might be an office worker, or does it just come on? Is it age, diet? Do you know?
I mean, absolutely, all those things take a part in it. So obviously, if you're aging, then you're getting more degenerative. So that's going to play a factor into it. If you work in office jobs, like you said, then again, that's going to be taking a toll on your posture, on all the sort of bones around it, like your scapula. And again, depending on how you're swinging, if you're swinging it incorrectly, like bad technique, then that's definitely going to play a role into it as well.
I think that's quite important. A lot of people who go, oh, it's a golf injury, when actually, realistically, that's why we do these history exams. What have you worked for? Did you do manual labour?
Yeah.
Was you at a desk for 40 years? And it's kind of clinically, we see the older population that come in with golf injuries, going on to ankles as well, but shoulder-wise. That's why it's important to look into, is it our posture? Most athletes as well, definitely the repetitive strain.
For sure, yeah.
I think we need to really cover posture now, because I would probably say everything. For sure, in clinic, my biggest presentation was a shoulder problem, but usually caused by bad posture. You mentioned scapula, which is what people commonly called the shoulder blade. But what we normally see, and I'm going to try and demonstrate this actually, a good posture when you're sitting, your shoulders should be back, okay? But more and more these days, as you're at a computer, we adopt this kind of
The
position.
rounding, yeah.
And then you're at home and you're scrolling through your phone, or you're reading a book, or you're on your iPad, or knitting, or anything. So we're kind of round shoulders all the time. Now, if you imagine, again, please, Francesca, in a bit. Francesca's our tech lady. If, you can do a diagram.
Yeah, I'll try.
But you've got your shoulder joint here, okay? You've got your collarbone just here, which goes across, okay? So you've got kind of like this bit, and then this bit, and then at the back you've got your shoulder blade or your scapula. And what happens is the scapula and the shoulder blade are here in this position, okay? But when we slouch forward, the scapula will rotate around, so coming around the side of your body. It should be here, it's coming this way like that, and the collarbone will kind of rotate around this way. So with being slouching rather than this way, we're going like that. And then the actual ball and socket of the shoulder, where the shoulder should be facing this way, kind of getting
Rotate
this kind
forward,
of
yeah.
Now what's important, you're going to say something in a minute. What's important here, you've got all the muscles of the shoulders are attached to the arm to have this kind of movement. The 4 muscles of the rotator cuff, your sits muscles, so your supraspinatus, infraspinatus, teres, and subscapularis muscles. That's how you remember sits. These all sit attached to the shoulder, and also you've got your biceps tendon, which comes up here and attaches through a little crevice in the bone, a little dimple in the bone, and it kind of comes up through and attaches through here. Now, if your arm's rounded all the time like this, that tendon can't sit up properly because the crevice is moving around a wee bit. So then that creates a lot of injuries up here. So you've got your bursitis, or your tendinitis here, and a lot of problems with lifting. But then if you're round shoulders and you're trying to lift or do anything overhead, you're trying to do an overhead press from this position, or even a chin up or a chin down, where the shoulder should be back. And a lot of people are getting injuries like gym injuries, but just a really non-specific shoulder problem that people are coming in with. And when we're trying to test, it's very, very difficult to find what's going on, because I bet you, but if one muscle's not working, another muscle's working to do its job. And so because it's working overtime doing another job of another muscle, it's not doing its job properly. So then another muscle's recruited to do its job. So then you've got all these kind of non-specific injuries in the shoulder and the upper back and around this area. And all of it is because there's a dysfunction and imbalance in the way that you're using your body, as opposed to a specific injury like capsulitis or tendinitis or anything else. Is that right?
Yeah.
What were you going to say something?
No, I was going to say about the bicep tendinopathy. I find it on so many people, even when people come to us with back pain as well, and then they'll later on mention, oh, I've had this for years, but I don't want to mention it. And it will always be my desk work, because I always check bicep tendon on desk work. Because chronically rolled shoulders, I will know that bicep tendon is popping. Or because if you think about it, you've chronically shortened it, and then it's going to react to this position, and then doing like wall angels and stuff like that, it's just going to be really painful and restricted.
Yeah, taking your arms back like that. Taking your arms back and trying to get your wrists on the back of the wall. So guys, give that one a try. Can you do that? I think as well, it's very telling if it's tender, if you kind of rub against here and it's tender. Probably got
people hate when I do it.
It's a sore spot. That one proper hurts.
I do pre-warn people, this may hurt a little bit. It is a sore spot.
Try it on your dominant side and your non-dominant side. There's a difference in sensation, actually.
Absolutely. More again, that goes into repetitive use. So when people are right-handed, I'll normally find that the right one is more kind of inflamed more and more painful, but I don't even have to tell from someone's face. I'll be behind and you can feel it, that's inflamed.
It's horrible.
It is a horrible one. And actually, I'd say probably about 80% of patients I see will have it.
I agree there.
Because our population, we are all sorts
very rounded.
Very rounded.
But then again, like you just said, if you're right-handed, you're normally right dominant, because everything's set up to be right-handed. I mean, even your scissors. Well, actually, these actually probably aren't. But most scissors, there's one bigger than the other on one side, and so they are right-handed scissors. The door usually opens the right way. Actually, ours doesn't. It's the left.
I was gonna say, I didn't notice that.
Contradicting ourselves. But most things in society are set up for right-handed people. So actually, it reinforces that dominance as well
Mm.
in your body, so it kind of makes you worse and worse as you go along. So the nice thing about being left-handed is, I suppose, it makes you a little bit more ambidextrous.
Yeah.
Using both sides.
Unique.
Yeah.
Definitely.
Put it that way.
Well, we were going to go from there. We were talking about posture. That's my big passion. Sports injuries there that we can get as well, or just regular injuries. And what I suppose what you can look out for, because if you've got a shoulder injury, you blooming know about it. It's painful and sometimes it's like too thick. You just can't find a position where it's comfortable, or you're kind of sitting like that and you're restless, or going to bed at night, sleeping, waking up with this worse in the morning.
It's
You mentioned,
It's very prevalent when you sleep. Like it's really easy to tell when you're sleeping. Like that's how I'd say most people find out about if they've hurt their shoulder or not. Is when they wake up the next morning and they're like, oh, I just couldn't sleep.
Yeah.
And then
I was
that
really
kind of,
uncomfortable.
I find out when people are predominantly when people sleep on one side, they're like,
Yeah.
it's really this side, I couldn't sleep on that, so I went on the other side and that starts to hurt that side. But then when you think about when you lay and then you're overstretching the shoulder, you're
Pushing it forward, aren't you? Yeah.
For about 8 hours minimum of the night, and then that will attach to a ribs, scapula, everything, and that's overstretching the whole biomechanics of the the skeletal system. So then that causes problems in the thoracic area and stuff like that. That's where we get restrictions, tightness. So sleep posture and hygiene actually has a lot to do with it as well.
For sure.
Yeah, I think a lot of people do ask about what kind of bed should you sleep on, mattress and pillows, and it's really about keeping your skeleton straight. And I was once told, I don't know if this is up to date information or if you guys got anything up to date, but up to 13 stone, you should be on a soft mattress. That's quite a considerable amount of weight actually on a soft mattress, because the amount of people that I know that are much less than 13 stone, considerably so, and are on a medium mattress. Between 13 and 16, a medium mattress, and then 16 plus is a firm. And that's so that your spine, if you lie on your side, stays straight and it absorbs enough of, especially for women, your hips and your shoulders, your curves, without kind of like making you drop, pushing against. I know my husband likes a really firm mattress, but then I will wake up in the morning, you always with shoulder pain. Also like numbness in my legs, where it's pushing on the nerves around the back area. Yeah, it's
going camping, just wake up and everything hurts.
Yeah, definitely.
Changing beds.
So there's that, and then the pillows, again, you should be taking into account the amount of giving the mattress. Your head should be straight if you lie on your side. So if you're sleeping and the pillow's too low, you're going to be doing that and you're usually going to wake up with a bad neck. Sleeping and the pillow's too high, it's going to be pushing along here, and you're going to wake up with a bad neck. So again, just try and keep aligned. I usually, for my patients, would say to them, lie on your side, put your shorts on, I want a picture of your back, and just to see whether or not what your spine looks like. So that's always a good way. If you're in any doubt, what I would say is get somebody to do that for you. I always ask them to wear shorts, because somebody once sent me a picture of them wearing a thong, and like, I didn't really need that. It was too much information. I just need from your waist upwards. Or your pelvis upwards sometimes, but I mean, I can do much.
I think it's a big question we get, and I mean, I ask in every exam as well, is when was the last time you changed your mattress is a big one as well. There's a lot of time, back pain, shoulder pain.
What do you think on that though? Because like, my personal, bed people are going to kill me, is like, it's not broken, don't fix it. You know, if it's not sunk in the middle and you're comfy, you're not.
I think we can become quite attached. Use it every day. For 8-10 years.
Yeah.
So
everyone likes their bed, don't
everyone
they?
likes their bed.
It's hard to know when to change it.
Well, I think if you're not getting any pain from it, don't. We had a really cheapy one from IKEA, and it was probably the best mattress I've ever slept in.
If that doesn't work, get a mattress topper. See if that works.
Tried that as well. Yeah, and I'll often say that to patients. Like before going to spend a lot of money on a mattress. If you think your mattress is too hard, or like one of you prefers a hard mattress and one of you needs a little bit more give, put a big thick mattress topper on, like none of these flimsy things, big thick one like that. Let it air for 24 hours. They usually stink when you take them out because of the latex in them. Anyway, we are so digressing. This is not.
I was just going to add to that though. I know there's now a lot of sort of things that you can buy for when you sleep. So I know there's like pillows made specifically for like if you lie on your side, where your hand goes under and sort of your neck goes in alignment. But yeah, there is those out there if you're really sort of.
I did try that when I was really injured last year, and it did actually help me. But then as I started getting better.
You don't need it, no,
Yeah, but it was good. And actually, again, it was a cheaper than one I got. It was from Amazon, so you don't have to spend again like hundreds and hundreds of pounds.
Yeah, absolutely. Or like how we always say for hips, trying to make like put it between your knees, you can always do it with your arms as well to make sure that it's not dropping.
Yeah, well, that's a good one. I never thought of that one actually. Give a bit of space.
That's what we do. Yeah. Your husband won't have like cry with the amount of pillows that are going in.
The pillows and the dog.
Get the maternity pillows out.
So where we got to, we have so digressed. I can't
It's
even
fine.
remember where we're at. So we've gone through all the kind of like different injuries, but like, and then how you can do them. So we've got bad posture is a big one. Fall onto an outstretched arm.
Yep. I've had one of those recently. Yeah.
Yeah, you get those where you can dislocate your shoulders.
Yeah.
The biggest problems I think sometimes is when you get kiddos that have kind of dislocated shoulders in sports, and then they can just go, I can easily pop it in and out.
Oh yeah, that's
dislocate all the time, and that's difficult to stabilise and to rehabilitate. So I think if you're a parent watching this, or actually if you can do that yourself, I'll probably not do that.
Yeah.
If you can help
strongly
it.
advise against it.
Think
Yeah.
about like how much we use our shoulders on a daily basis as well. I reckon probably not as much as our legs, but we do kind of use it in more motions wise. So it's so important that we look after our shoulders for later in life, especially.
Well, it's our most flexible joint, isn't it? So of course, I think I read somewhere where if you're the more your sort of joint at your shoulder is flexible, the more risk it is of getting injured.
Yeah, absolutely.
Yeah.
So
It's more unstable.
Well, think about like how we spoke about summer sports injuries and stuff. It's common in rugby
Yeah,
when people land on the ball, that the shoulder dislocates.
and the
out.
impact on tackling as well.
Anything really. I've dislocated my shoulder from shooting.
Exactly.
You know,
Yeah.
that was just
the kickback.
the kickback. So it depends how going into hypermobile you are as well.
Yeah.
So it's important to understand: are you flexible? Could there be a risk? Do you tape it? Do you secure it? Have you rehabbed it? Are your muscles strong enough to support it? And everything like that.
I think that's quite important though for people to know, and I mean that's where we can sort of help, isn't it? If they come in and we can sort of check their flexibility, especially if they're playing sports quite often, like tennis or like golf or anything.
Yeah.
Then they should really get it checked out, because it might be a case of they just need wrapping before like they play or something like that. But
Yeah.
that
Before
could
it starts
definitely
to
cause some
progressively
issues.
get
Yeah.
worse and stuff like that.
Yeah, because prevention's always better than cure. And I think that's a good one, actually, just making yourself aware of how mobile your shoulder is. I suppose if you are more mobile, you are more at risk in a lot of ways. But then the opposite as well, if you're quite tight in your shoulders, you're also at risk.
Exactly.
So if you start going to the gym or pick up a new exercise or something like that.
I think one of my like pet peeves is seeing people go to the gym, do their sport and everything, and they don't mobilise their shoulder.
No.
I think it's one of the most neglected kind of muscles, kind of joint in the body that's neglected. So I think sports massage helps, especially because a lot of people don't come get them, and it's always tight. You know, I'm always mobilising shoulders as well because of that. It's just so we always think about our back and everything like that, our hips and stuff, but we never really think about our shoulders as much until it hurts.
Yeah.
So.
But I think as well, you talk about massage. I agree. Massage massively helps. But a tight muscle is normally a weak muscle, and so mainly for women, we've covered this before in kind of like muscle mass. Women don't build muscle on their shoulder as easily as men. We're more legs and bums, and vice versa for guys. So my shoulders have always been weak but very tight, and my shoulders were probably at the most mobile in a good way. When I was weight training, I was stronger. Equally, I managed to damage myself doing that, so it's getting that happy medium. But I think making sure that the muscles of the shoulders are strong enough to support those everyday activities as well. Even if you are hypermobile, the kind of exercise you'll do is different and much smaller, but you still need to make sure your muscles are strong. And I think a big part is like the posterior, so the back muscles of the shoulders, because if we're like this, what's happening is these muscles become really short and tight here, and these muscles become long and weak because they're kind of stretched and they're being overworked and underpaid. So we kind of like focus on stretching the pec and the front part out, but strengthening the back of the shoulders. And that could be through any ways. You like Pilates, and that will definitely help.
Absolutely, yeah. Pilates is so good for sort of any joint mobility, really. It's not just the shoulders, but yeah, it does definitely help the mobility and that sort of range of motion in your shoulders.
And then you do a lot of martial arts more than anything else, so that would help as well.
No, absolutely. So martial arts is one of the biggest kind of injury in sports as well. So I've seen a lot of dislocations, mostly falls on shoulders, like from falls in general, broken shoulders. So it's about rehabbing, because there'll be bony growths and stuff where it's tried to heal, and then the muscles will try to support it. But that's why we have our rehab as well.
There you go.
So I think just picking your poison in terms of like what exercise you like to do. I enjoy yoga, and that works the muscles. And I think as well now there is definitely a movement where people are exercising more and not being as frightened to use weights, especially women, which is lovely, and it gives that gorgeous definition on the shoulders, and obviously stops the bingo wings, which I'm all for. Anything to stop those. But working the back of your shoulders is going to stop your bingo wings anyway. So like, just finding what exercise suits you as well, but doing something, and it doesn't even have to be going to a gym. Like you could do like a triceps dip, just going up and down on a desk, or doing some sun salutations, downward facing dogs, high plank into low plank.
For sure.
That's still going to work the shoulders.
A lot of just body weight stuff works really well for the shoulders and your core, really. So it's a good way of knocking them two out at the same time, and your back even. So when you do sort of body weight stuff, it's working all three of those, I'd say, main muscles to prevent injuries.
Yeah. And so like really when we move into kind of, we're talking about injury, we do see a lot of people with this, which is absolutely fabulous, but I think people shouldn't be frightened of getting help when it comes to having shoulder injuries, but also getting help sooner rather than later, because with a shoulder injury, like we kind of touched on before, if one muscle stops working and not doing its job, then other muscles are going to start getting involved. So I think really the sooner you get some form of intervention, and we're not pushing here to come and see us because you could be in Middlesbrough or something, a bit far, but get help sooner rather than later, so that it doesn't become a bigger problem than it needs to be, for sure. And it can be as easy as just do this exercise, which will help, or a bit of massage, a bit of manipulation,
for sure, a
bit of postural
changes as well, general postural changes. But again, it takes that takes habit as well, because postural we will forget, because it's been our natural, the way that we sit, stand, everything for about 20 years, I'd say, normally. But I think going back to shoulders, it is probably one of the most neglected. So whenever someone comes in for a shoulder, it's been going on for 6 months, so it's most chronic shoulder conditions that I see, rather than acute or this happened 3 weeks ago. So it's always, I think we just neglect it, and it's always good to get them sorted out quicker than later, because you need your shoulders, you need your arms and that.
Just to add on that, because I know shoulders, like you said, are very neglected. So what often happens is, for example, a tennis or a golf player, they'll get a little like injury in their shoulder that they might not be aware of, but then what that does is cause so many different problems around their body. So whereas I normally find their neck is really tight because their shoulder's quite damaged, or that's how they get tennis elbow, because obviously, like you said, the origin sort of starts there, and because they've got that injury in their shoulder, their technique's a bit off, so they're continuing playing tennis with something that's stopping them doing the correct technique. That leads to tennis elbow, and then
can also create pelvic problems, believe it or not. A bad shoulder can create pelvic problems. So
scapula goes off. Like when you get one injury in the shoulder, it can really affect sort of everywhere in the body. So definitely,
I think that's important. Like so when we do spinal screens and stuff, when we're checking people's posture, everyone's like, oh, it's my hip out, I think I stand a bit funny, whereas actually we can tell more from the shoulders, I think. So one shoulder's higher, and then we'll be like, would you like a photo of your posture? And then they'll be like, I didn't realise that forward. So we always see like the anterior head carriage, but realistically some people's shoulders come forward a bit more, and then I'll ask, are you a desk worker, and always be the same case.
Yes. For sure. I think desk workers are probably if you are a desk worker, you're probably at the most risk. Certainly if you're a desk worker and a weekend warrior.
I could tell you exactly where the knots are on a desk worker straight away, without even needing to touch. Like,
don't tell me it hurts here.
Let me guess, this is going to hurt. Straight on the point.
Honestly, no, because it's to do with the dominant muscles, isn't it? When you're always like that, then these muscles become dominant instead of the ones in your back that are needing to be.
Yeah.
So then you're always going to have tight pecs, you're always going to have your tight traps in your neck.
And you see those at the gym, I think less now, but those guys at the gym where they're like Hulk from, like there's no definition at the back.
No, it is just dominant muscles end of the day, innit? And it's, like you said, working out of that habit to be able to switch on the right muscles, to have that correct posture, to have that correct technique.
Yeah. And usually if you don't like an exercise, it's probably because you need it.
Yeah.
as well. So don't bear that in mind. If you don't like shoulder exercises, you probably really need them.
Well, that's the thing. We get a lot of people who are like, so can you do a push-up? A lot of, predominantly more towards women, can't do a push-up. Have you tried it on your knees? Have you tried strengthening your shoulders? Have you tried even trying to do negative? So you're doing it from up
like a wall,
and then down. So I think people they just go towards, I can't do a push-up, seen in the gym and stuff like that. But really, you should just take it back and then build up the muscle strength.
For sure.
Yeah, and it's really important to actually be able to just push yourself up without having to go back down, because if you ever fall as you're older, being able to get yourself up off the floor is super important, particularly if you're on your own in the house. So actually, that's a really good point as well. So anything else that we need to cover?
I think maybe prevention.
Yeah,
like how they can.
that's a really good
Yeah,
point.
that's a really good talk about our rehab.
Go on, Raddy, over to you.
Well, I mean, the way I can help obviously is with massage. So if you, like I said, if you play a lot of sort of tennis, golf, or anything, like Laura said, overhead, even gym, you're bound to have some knots in your shoulder. So I can sort of help massage those out so it prevents those sort of overuse injuries in the future. So no tennis elbow, no more sort of frozen shoulders, impingement, nothing like that. And again, I can help strengthen, so build on those muscles around your back and your shoulder and your bicep, everything, to then again help prevent you getting injured.
Yeah, I think that's important. They say prevention is better than cure, making sure you're taking care of any postural imbalances, whether that's bony, because you've got this forward head carriage, then it becomes habitual, then it becomes bony and then muscular, or whether it is just muscular, or whether it is just, you've got into some bad habits, you lean on the sofa every day, you have this computer where you're leaning forwards and you're looking down and working with your laptop. All of these things can easily be changed to change your life and make things better. I think a lot of people think that they can exercise their way out of things. It's not always the case. So if you've got an injury, sometimes you need a bit of a kick in the right direction or persuading in the right direction. We don't kick.
No.
So if you try and do exercises and it's not helping or it's making it worse, just make sure that you get help from somebody as well, because it may just be that it's the wrong exercise, it's the wrong muscle, you might not be doing it right, because if you're doing it and you're ever so slightly further forward, you're going to be making yourself worse or fixing yourself worse. So just bear that in mind as well in terms of prevention.
Sure.
I think going towards like athletes, anyone who's going to go to the gym as well, warm-ups are so important. We spoke about this on our previous podcast as well, but the way that I see people neglect warming up shoulders especially, so I like to, personally, my favourite warm-up would be internal, so we call internal and external rotation, so it'd be taking a band and just doing this motion, even if it's a small one, a light band, you're still getting the motion there, you still mind muscle connection, and then you're warming up the muscle for it. Because if you go and do heavy weights or you go straight into a sport and you're not warmed up, it's just gonna.
That's how it pings, isn't it? Yeah, that's.
Yeah. It's like on playing tennis or going for a run and not warming up your calves and wondering why you've snapped your
Yeah, exactly.
And listening to your body as well, knowing when you've either done too much, you're getting too tired, or like with my shoulder injury, I can do this one with yoga. Not very well either, but I can't really do this at all with that, and it doesn't feel. I can't explain it, but it doesn't feel right. It feels like an impingement actually. And how do you explain that? I have no idea. But it doesn't feel normal. If it doesn't feel normal, sometimes just don't push it. Don't be frightened of pain, but just listen to the different kind of pain it is as well. So there's a difference between the pain of, I don't know, going for a run and getting through it, and the pain of spraining your ankle and running, I guess, as well. So be try and get body aware with what you're experiencing and try and work through what you think it feels like, I guess.
Sure.
Yeah, and then going back into kind of like exercise form is really important. It's really hard when you're new to the gym or new to a sport and you don't have that support with you as well. So you don't know machines, you don't know what exercises to do, how to do them as well, what weights to choose as well. So it's always good if you choose maybe like a PT or like Raddy, how he'll take you through or make you a plan based on your body and how it works, and then what needs strengthening and stuff like that.
For sure, yeah.
Do you want to run through, Francesca, like from a chiropractic point of view, what we do for treatment as well? Or
yeah, absolutely. Shoulder wise, there's quite a lot we can do. Mostly, I think Personally, I do a lot of mobilizations with the shoulders because the joints themselves get really tight, and again because the muscles are imbalanced and stuff, so taking the joint out and kind of giving it that free space again. I do trigger pointing with the myofascial kind of release and stuff. Mostly what we call emphasis disruption on the bicep tendon. It's a killer, but it's good. It's good, I promise. Yeah, it's a good one. And then I actually find that adjusting the thoracic spine, the ribs and the shoulders, mostly more than the shoulders, people find more relief from. And again, if you think about it, if you're coming more forward like this, your whole thoracic spine is kind of compensating for your scapulas and stuff. So by adjusting here or here, we are bringing you back to that normal alignment and releasing it off. Yeah.
Another thing actually we've not touched on is arthritis in the shoulders as well.
Yeah.
Because I think when you've got imbalances in the shoulders for longer, then your wear and tear is going to be accelerated. And what I mean by this is I'm quite a visual person, so I liken it to getting a car, with a brand new car with 4 brand new wheels and a perfect chassis frame. And if you go on a, sorry Maidenhead very council, if you go over one of our many potholes damage your chassis frame, then of course it's going to put more wear on the wheel on one side. Or like if you go round a roundabout, like in the UK we go round a roundabout one way, is that way, a lot, then you get more wear on that front right tyre. And it's the same thing with a shoulder injury. If you're looking on a mouse all the time and you're doing this, you're bringing your arm forward, then you're going to create the joint capsule, the joint space is going to be further, but it's going to be butt up more on one side for a lot longer. So you're going to increase the rate at which you're going to degenerate. So it's important to kind of do things to undo the damage. So if you're spending a lot of time doing this at work, and try and strengthen the back of the shoulder and do things that you can bring your arm back with. So maybe tricep kickback exercises or on a band or something. Even just nothing, a tin of beans if you want, but making sure you kind of work the opposite side of the repetition side to kind of reduce your risk of overuse, which will then reduce your risk of arthritis. If you've got arthritis as well, osteoarthritis in particular, that is a wear and tear issue. It really isn't genetic, which I think a lot of us think it is, but generally it's not. It's just wear and tear. So we all think it's genetic because we all get wear and tear. But there are things that you can do. You may be not doing some of those exercises that could be undoing a lot of the problems. You may have a lot of build up in there, which could be stripped right back, and you may be doing things to aggravate the problem and further enhance the wear and tear, which you could actually undo. So it's always worth, again, speaking to somebody and finding out the things that you probably are doing that you don't even realise you're doing. From a osteoporotic point of view, that's a very, very different way, but I think really osteoporotic people don't really suffer with the shoulders. It's more osteoarthritis and then rheumatoid arthritis with joint pain and
it's just more of an inflammation one.
Yeah, and that's a completely different issue altogether because that's more autoimmune, which we discuss another time. That's way too long. Well, there's another one on arthritis as well. I think actually we've probably covered everything there. So, guys, if you've got any questions, drop it in the box below because we'll be happy to answer anything as well. We're going to be doing a series on our social media Instagram about posture mobility and the postural scales, which on the back of this will be really interesting. So give us a follow on Instagram. So it's Maidenhead Chiropractic Clinic, or Facebook, Maidenhead Chiropractic Clinic, and we hope that we can, be able to educate you even more, little tidbits rather than this just once a month. And if you could give us a like and follow, we would really, really appreciate it. And we hope to see you next month. Bye.
See you later.